Hi everyone, welcome back. Today we have Dr. Joanne Reid. It's a pleasure to have her here for our health equity campaign. And she is a pediatrician at the Health Rural Clinic in Willows. And Dr. Reid, would you just like to explain a little bit more about your background and experiences?
I'm a pediatrician and I run a rural health clinic in Willows, and that is a clinic that serves underprivileged children. I serve about, I know my statistics, over 80% Medi-Cal, and probably about 50 to 60% are Hispanic or Spanish-speaking patients. And that is my husband who just walked by. Yes, okay. All right. I started the clinic 13 years ago. I am the medical director. I presently have a physician assistant named Sarah Mellum. She's been with me for 4 years. I have a chiropractor who works in my office 2 days a week. And recently my daughter, Dr. Rebecca Baining, joined me after completing her pediatric residency. So she has been there since last August. So in summary, there's 2 pediatricians, a physician assistant, a chiropractor, and then I have about 10 other employees who have been with me forever. So, okay.
Wow, that's great. The practice sounds great. And sounds like there's a lot of professions to help the rural community. And we're also touching on pediatric health equity today and also rural health equity.
Yes.
And Dr. Reid is the perfect person for this interview. So thank you so much for taking your time to come out today. So one of my first questions for this interview is, with the occupation that you have as a pediatrician, you understand the importance of early life development. I just want to wonder and ask, what are some of the drivers of health inequities and disparities in child development?
That is a big question. And that is the whole point to pediatrics. We understand that a healthy, happy, nurturing environment is necessary for a child to grow. And it actually starts at the moment of conception. You need a healthy, happy womb. You need a healthy, happy mom who's pregnant. Once they're born, you need a healthy, happy, stable home environment for that child to bloom and grow. Think of it as like your own garden. You need healthy dirt, you need healthy plant for the plant to grow. You need everything. You need sunlight, you need some fertilizer. And it also, so it's a healthy, happy family, and it's also a healthy, happy community, because as we all know, it takes a community to raise a child. I'm very excited to hear that our President Biden is trying to get more funding for younger children for preschool. Right now, preschool is funded from age 4 and up. There's a transitional kindergarten, there's lots of things. But really a lot of the children I see, a lot are single parents. It is very difficult for them to work and make sure that their child is in a safe, nurturing place. And then COVID put us all over the edge, put us all over the top. Now parents are scrambling, kids are home. Legally, you're not allowed to be home alone under age 12. I suspect many children were still home alone and were left to their own devices. We know we've lost a year of I'm going off on tangents here. We have lost a year of education. I am seeing mental illness skyrocketing, both in the parents and in younger children. Morbid obesity. My record is a young man who gained 78 pounds this past year. So we have a lot of work ahead of us to get everybody back on track. I'm hearing more and more about initiatives to address mental health issues. They were there before. Now they're just a lot more obvious. And the mental illness really affects the young children more than people realize. Go ahead and ask me another question, because I know I'm way off track.
No, that was a great answer. Thank you so much for answering that question.
So I am now very involved in a pilot program called ACEs, which stands for Adverse Childhood Events. My office is in Glenn County, and my office was the recipient of a recent grant from the state for this pilot project to address this in our community. Originally, we were just going to start screening parents of 6-month-old children, just to kind of get a baseline. We know our numbers are terrible, but we didn't quite know how bad they were. Within a week or two of starting our pilot project, we realized we had opened Pandora's box, or someone said we had ripped a Band-Aid off of this issue, and it's just coming out. And thankfully, there are more and more people that are acknowledging we have an issue. COVID actually, I think, brought it to the forefront that we have a lot to work on in our communities. Very importantly, we need to start with young children, because what we've learned, if young children are not loved and nurtured and grown properly, it extends through adolescence and into adulthood. We're not just talking mental illness, we're also talking physical illness. By physical illness, I mean they're more at risk for cardiac disease, high blood pressure, hypertension, I guess that's the same thing, obesity, asthma, allergies, and then it just becomes a multi-generational problem. So we are starting to make inroads into addressing the issue and how we can help people. It's going to take a lot of work, but more and more people are getting motivated to do this, and that's what it's all about. Okay.
Well, that was a perfect answer, Dr. Reid, because my next question is, how can we better support families and their children to meet their needs? And addressing ACEs is actually furthering pediatric health equity. And remember how we were just talking about ACEs, how we need to interrupt that cycle in order to really prevent and heal those who have experienced traumatic experiences, right?
So at this point, I would encourage everyone to watch a TED Talk by Dr. Nadine Burke Harris from 2015, and she talks about ACEs. And she has also written a book called The Deepest Well. There's lots of information out there on ACEs, but I would encourage people to start reading about it and getting informed, and of interest, do your own ACEs score and see how that's impacted your life. As part of my pilot project, I actually had a county health worker in my office for this past month. And I was screening people, and as soon as I would screen them, then I also had a form on there that would say, and then I would present it to the parents and say, how can I help you? And what was interesting is one family, a grandmother who had just acutely gotten cancer and died, and she was definitely the rock in the family. And so I did an ACEs because I wanted to get them into counseling. And actually, the mother did not want counseling. She wanted help with a dietitian and finances. I mean, because a lot of times people don't even know what they need. They don't know where to begin. They don't know how to start. They don't know what services are available in the community. What we're trying to establish is what we call a soft handoff, meaning this mother then wanted a dietitian and financial help. I then was allowed to I got consent from the family to talk to my health worker, and this health worker then is going to personally make sure that she gets an appointment with someone to help her to get a dietitian appointment, or get an appointment with someone to help her with her finances. In the past, what it had been is I'd go, oh, you should call here and do this and do that. But what we have learned is people are just so overwhelmed, they don't know where to begin. So that is what we are trying to do in Glenn County. We are trying to to actually get those people, get them an appointment. It might even be to the point where we will drive them to their appointment. We're trying to set up tentacles in the community and everyone talk to everyone else. In the past, there's been a lot of issues with HIPAA. And so I can't talk to my teenager's parole officer that they, tried to kill their sister. Okay, I wasn't allowed to know that because of HIPAA. But because of what we're doing in the community, everyone is talking, so everybody knows what's going on. We're trying to help these people get the help they need. Because if the parents are stable and better, their children will do better in life. And that's what it's all about.
Right. That's fantastic, Dr. Reid. Thank you so much for answering that question and explaining what's happening in Glenn County at the moment. I hear a frequent problem is when people get referral to services, we don't really know what happens to that patient after that referral is sent out. Do they really get the help that they need? So it's glad to hear that you guys have a direct service and system to make sure that they're getting the help that they want because they're so overwhelmed at the start.
Correct. And that's what we all there are services out there, and everyone always says, oh, there's all these services, but people don't use them because they're overwhelmed. And just like when I get on my exercise program, the hardest thing is putting on my tennis shoes, right? And making the time to go. So it's the same thing. If we make them the appointment, we actually drive them there, get them in there, get them going. And that's what we're trying to set up. And also we're trying to set up a feedback system to me. And so right now what we're doing is every Monday, this county health worker is showing back up off at my office at noon, and we're going to go through all the referrals that have been made and what she has done. And it's not her just giving someone a pamphlet. It's physically saying, I got this. There was one young mom, she was living in a small apartment, no transportation. She just needed a lot of help. And she got her little guy into preschool. She helped find the mom a job. She got her transportation, got him an appointment at the dentist to get his teeth fixed. This was all in 2 weeks. These are things that I know if this had happened 6 months ago in my office, I would have looked at the mom and said, oh, you need to get him in preschool. It would not have happened. So we are already seeing, we're not talking about big, huge jumps. We're talking about little pitter patter, little teeny tiny steps, and one step at a time. I am part of a great group in Glenn County that actually got this whole grant going. They brought in a consultant who has helped do this in other counties, and she was phenomenal. So we're all learning what works best for each individual office, which individual county, people, but it's just people getting out there, being aware, trying to make a difference one person at a time. So, and getting back to caring.
Thank you so much for answering the previous question. How do you see changes we can make towards pediatric health equity in the upcoming years? I feel like you have answered that question before, but do you have any other comments on that?
I would like to see people getting off their electronic devices and letting children be children again. I think too many parents are they themselves are stressed and overwhelmed. They get home from work. I don't see, going back to the 1950s, right, where people sat down and ate dinner together. People need to go to church. I am not really a religious person, but I find that it's a place where I had a young girl, she wants to be a singer. And I said, oh, do you sing in the church choir? And she goes, no. And that's where many famous singers learn to sing, is going to church. Places where you can have, get out in nature, like hiking, get out playing board games, playing cards, doing family activities again, going camping. It doesn't always need to be Disneyland. People need to get back to enjoying, I think COVID has taught us that, enjoying the simple things in life. And that's where I think parents, if they would get off their phones and get back to enjoying the family unit again, I think is a big step backwards that we have done in the past 20 years. So that's what I see. I'm old enough to tell you, that's what I've seen.
I would totally agree. The generations are extremely different, with especially advancements in technology. We should really rely more on the social support, because I hear that really affects, your different health outcomes, and having all these social interactions with others, and how you're saying we should spend more time with family, spend more time with friends, rather than being behind a screen. And you're right, COVID has taught us that, and that we kind of took that for granted. And seeing that if you're just, sitting and sedentary, that just, increases your risk of health problems either way.
And one of the most positive predictors of children healing from ACEs is to have a positive adult in their life. And that adult can be their parents, but it could also be their Boy Scout leader. It can be a teacher. It can be your best friend's mother. It can be various people. And I just see a lot of people kind of got stuck in that, so much anxiety, staying home, not letting their children go outside and play, not letting their children explore. And they themselves aren't getting out and exercising and exploring. So that's what I see in my neck of the woods.
Right. Okay. And I would love to see that change happen in the couple of years, hopefully.
Yes.
But right, how you were saying, it's baby steps, slowly but surely.
Baby steps, yep. So, yes. Okay.
Great. All right. So one of my next questions is, given your experience practicing at the Rural Health Clinic and also being in one of the more rural areas of Northern California, what health challenges are faced by the rural community?
I would say my biggest frustration is getting referrals to specialists out of the area. Okay, so when, as a pediatrician, if I need to send someone to a pediatric cardiologist or a pediatric neurologist, I have to do referrals. There's none in Northern California, so they all have to go to big cities. And that's usually, okay, parents are willing to travel, but then comes in the issues with insurance. So my patients are poor and they're on what they call Medi-Cal or managed Medi-Cal, and then it becomes political. And the politicians get to decide which place they get to go. Okay, if they need to go to, for me, there's Sacramento, there's Oakland, there's San Francisco, or there's Stanford. And many insurances, they get to dictate the child's care. And it's a political, not a what's best for the child. Okay, so I would say that is a huge burden upon many families. So we're trying to work on that. But I really can't, I don't have any say in that. I have to do what the insurance company says we can do.
Right.
So that is a big issue. Medication wise, not a big deal. Access to care, we're very available. We're good on that. I don't think that's an issue. But I think from a personal point of view, my biggest problem is getting referrals and specialist appointments for my patients. And again, that's a transportation issue. If you're a single parent, you have to take the day off work. Going to Sacramento or San Francisco for the day is a whole day event. Your appointment's at 9 in the morning. You have to stay overnight. I mean, it's a whole big deal to do that.
I see that it could take a toll on families who may not have resources to be able to take their children all the way over there, or even afford or be fortunate enough to take that time off.
Right.
To go to a doctor's appointment that's 4 hours away.
Right. And that's back to where, again, we are with this ACEs grant, is we're trying to get more services for transportation, for gas, or, you missed a day of work. That's a fifth of your income for the week as a single mom. That's a big deal. That's food. Or, food pantries, access to, anyways, we're working on all of it. Yes.
Right. Yeah.
So
it all ties in together.
My biggest problem is referral to specialists. Mm-hmm. Okay.
And would that ever be a realistic way to think that maybe to bring specialists to rural areas?
A few do come to Chico, but there's not that much need for that specialist to come up here. The pediatric cardiologists come up and the pediatric endocrinologists come up. But again, it's dependent on what the child's insurance is. Isn't that amazing? Mm-hmm. Yeah. And then, and on the other side, these specialists are not paid to see patients with Medi-Cal. Okay, so I understand why they won't see them, because they don't get paid. Right. So we'll see what happens with insurance in the future. If one insurance or what we're going to have to do, but that needs some fixing.
Mm-hmm. Yeah. Okay. All right. Thank you for answering that question, Dr. Reid. One of my last questions now regarding rural health equity is, what can we do to close the gap in health disparities between rural and urban areas? I
don't know if you're going to fix that. I guess it's kind of what I said last time too, is making sure that my children, my patients, have access to the same specialists that children in urban areas have. And again, that's politics. So, and transportation and, everything else. You can't, as a small town cannot support a pediatric cardiologist that's going to see one patient a month. Okay, it's not going to work.
It's not realistic, right?
But somehow, I think just access to care through the insurance plans. I employ one person, okay, that is her only job, is to do referrals, okay, because she can spend a whole day getting one patient an appointment. And I am not exaggerating. She can be on hold for hours when she's calling someplace, and then it gets involved, but you have to get prior authorizations and this and that and this, and then inevitably we'll let the family know, and then the family will forget to go to their appointment because, you know, who knows why. There's lots and lots of reasons, and then we have to reschedule it. And we're to a point now, one of the managed Medi-Cal will now actually provide transportation for these families to go to their appointments. But they have to, one, know about it, okay? We didn't even know about it. Okay, we have to know about it. And then two, they have to call and schedule it. And then people are always a little hesitant to get in a car with a stranger, okay? And some stranger's gonna drive me and my baby to some random appointment in Sacramento. Okay, so that's a little scary unto itself. And so that's getting better. Word is getting out there. You know, they're very safe drivers. They wait for you. They bring you home. I've had some really cute stories. You know, families that have to go every week to see a specialist, they get their same driver every time and stuff like that. So we're making progress, but it is one little hurdle after another. And each family is different and special. And so we're learning. We're getting there. We're working on it. Okay.
That's what we like to hear, Dr.
Yes.
Reid. Thank you so much.
All right.
It sounds like it's more of like improving systems and just figuring out different insurance policies that maybe, you know, not have people's, you know, be tied down with, so we can better provide access to care to these different families.
Yep.
Thank you so much.
All
Thank you so much. That would conclude our Pediatric and Rural Health Equity Campaign interview for today.
It's never boring. It's always exciting, and I'm constantly learning, as we all are, and, you know, trying to make things better. You just have to keep a positive attitude and go, yeah. So
right, this is what this campaign's all about. It's just for hope for the future and what differences we can see.
Correct.
In the stride to health equity.
Exactly. Okay.
All right. Thank you so much, Dr. Reid.
Have a good day.